My name is Tanya Collin-Histed. I have the privilege of being the CEO of the International Gaucher Alliance. I've been a patient advocate for 28 years now. So I became a patient advocate because I had a daughter who was diagnosed with type 3 Gaucher's disease when she was 17 months old, and it's I needed to find information, I wanted to know what I could do for her, and hence became a patient advocate. So I worked first of all in the UK and then in Europe and now globally. So the International Gaucher Alliance actually celebrated its 30th year last year, so very proud of that. And we are an umbrella organisation. So our members are national patient organisations for Gaucher patients, some of them across LSDs or rare diseases. But we recognise that many countries don't have established patient organisations. So as well as having 60 members, we also have a footprint or contacts in another 62 countries globally. So she's actually 30. So when she was diagnosed at 17 months, we were told not to expect her to survive. She has neuronopathic Gaucher's disease, so there was a lot of unknowns. She has some challenges, but she went to university with support. She's married, she has a job, and now she has a child. And I really believe that has been because she has had access to great clinical care. She has also had access to management treatment, and she's had a support network around her, including support to be able to access the national curriculum and achieve her best. And that's really how she's lived her life. So yeah, she's 30 and she's independent, and I couldn't be more proud. So she was diagnosed in 96. So Severity had already been on the market since 91. So she was diagnosed in the January, and she started treatment in the February. I mean, we lived near London, which she was born in Watford, so they had shared care with Great Ormond Street. And she was originally diagnosed with leukemia. So went to Great Ormond Street, had a bone marrow aspiration. No, it's not leukemia, but we think it's a rare disease, and we think it's Gaucher's disease. And yeah, she was given treatment. She had a partial splenectomy. She was very poorly for a year, but yeah, I mean, we were just very blessed. And of course, it was paid for by the NHS. So as I said, the IGA, we're an umbrella organisation, but we recognise that even though there has been access to treatment in many countries for 30 plus years, in many countries around the world there just isn't the infrastructure. There's no access to diagnosis, there's no awareness of Gaucher or rare diseases, there's no clinical centres. So the International Gaucher Alliance, we work with volunteers in countries where we don't have memberships. We connect with doctors, and we start to look at how we can empower and support that environment to bring in diagnosis, educate doctors, and then develop clinical care centres. Everything the IGA does, we do in collaboration. We identify who our partners are, and if a doctor suspects a Gaucher patient in, say, Kenya or Ethiopia, they don't have access to diagnostics. So what do you do? So working in partnership, the IGA work with an organisation called A Rare Cause, and we've been able to get funding to provide dry blood spots cards, and then work with a facility in South Africa to get the diagnosis. And then from that, we've then worked with some other companies who have charitable access programs to then bring that treatment to those patients if they're deemed eligible. And then we're now working to develop in-country registries where the healthcare professionals can enter that data on patient information, how they're doing, they can understand the prevalence, and then they can take that to help shape their policy in their country, because at the moment there's just nothing. In many countries, patients carry all of their clinical information in plastic bags and they take it with them to the healthcare professional, so that information isn't in the hospitals. And the only way that we are going to change the healthcare systems is with evidence and data. So I think that we recognise that there are, as a physician in many countries, there is so many health inequalities, and we recognise that it's always the same doctors that are trying to meet the needs of their patients. And I think that the takeaway message is you don't need to know about every single rare disease, but you need to understand the nuances with rare diseases, and you need to welcome and be open to work with experts who maybe come from outside of the country to learn about specifics with these rare diseases, and embrace that we are, in some countries they're like 20 years behind where we are in, say, the West, but the enthusiasm and the recognition is there, but they need a lot of support. So I think you don't need to know about every rare disease, but you need to know about the nuances, you need to know where to get the information, be open to collaboration. I think that disease awareness, I think working collaboratively, we still find adults with Gaucher's disease who haven't, they've been looked at sort of in like more local centres, and they've been sort of kept there. So I think it's just education, making sure that we keep information up to date on the internet. People know where to go when they want some advice or help. Patient organisations obviously play a huge role in that. There will always be patients that it will take longer to diagnose and to identify. But I think that we are doing a good job to ensure that diagnostic pathway is getting shorter and shorter. I think there are two different sides to the Alliance. I think we are a member organisation, so we see our role as providing up-to-date information about empowering national patient organisations to be able to work in their own countries and meet their own the needs of their own patient community. And I see that as one of our key roles is empowerment, enablement, dissemination of information. And then on the other hand, we, as I said before, we know there are many countries where there aren't patient organisations, but we know that there are patients. Therefore, our involvement is much more hands-on. So the IGA do a lot of work in terms of being people's, a family or a person's person. So they come to us, they live in a country where there is no awareness, there is no access to treatment, they've got nowhere to go, and the internet is a powerful thing. They find the IGA and they say, I need your help. So we're much more hands-on with those patients. We see, for instance, patients in Sudan. We knew that there were patients in Sudan. We started to work with a healthcare professional. We started to support diagnosis. We started to link them with charitable programs. Then the war broke out, so they were displaced. So we helped them to go to a different country to get treatment. So on one hand, we do very high level education, information, consensus papers, guidelines, and then the other side, we are there to hold patients' hands and to walk with them through their journey. So we're a very, very diverse organisation. We recognise very early on, as a global organisation, there's big expectations to be everything to everybody, but we had limited resources. So we now have a volunteer program. We have over 55 volunteers who work for us, and that's the way that we have a global footprint. And these are people sometimes that have been Gaucher patients who were given treatment young or charitable access, and they are now living their best life and they want to give something back. So they are working in places like Africa, Central America, India, the Far East, and they are our eyes and ears in those different parts of the world. So, I think we have sort of two arms to us, really. But we believe we represent over 90% of the global Gaucher community. One of the things I think I would really like to emphasise was the IGA celebrated its 30th year last year. We were born out of being invited by a group of clinicians and researchers back in 1994, after the development of the first enzyme replacement therapy for Gaucher's disease, to be part of a European scientific meeting, and that was the European Working Group on Gaucher's disease. Because we were invited, and patient advocates from the West and Europe, etc., came to that meeting, that was how the then EGA, the European Gaucher Alliance, was developed. And we became the IGA in 2018, recognising that many of our members were international. But we have had this journey with the physicians and the researchers from the European Working Group on Gaucher's disease. We have a seat on their board. They're now the International Working Group on Gaucher's disease, and most of the work that we do with the clinical community. So we were enabled to be part of the journey by that platform of scientists and clinicians, and we're still working with them today. And that is so important, that the patient organisations and the clinical community and scientific community work hand in hand.